first and foremost, what I've seen
Hmm.
from Doug Ford, and it's funny because he was recently, I think it was yesterday, he was at the press conference. He was raging about price gouging. We
Hmm.
know price gouging is it's starting to be a big problem as we saw everywhere. People are trying to take advantage of the situations. They're buying Lysol wipes, whatever, and they're trying to sell it online. I know some websites have banned the sale of these products, so I think that's a big step.
Hmm.
But also, Doug Ford with Ontario is he specifically said like we'll come after you whoever
Hmm.
attempts to price gouge, and I think for the most part he's done a good job also showing that leadership and showing that he's trying to protect the people first
Hmm.
and foremost. Also, obviously, some people who aren't big fans of Doug Ford
Hmm.
kind of sees him as a hypocrite, obviously, because he thinks he's a capitalist or whatever, and they're like, well, why are you mad at price gouging now, but not in other cases? But I think for the most part, he's done a good job, and he's shown the leadership that we expect from our premier, and all these plans put in place, and I'm happy that they finally got the bill passed and they reached an agreement. I think will ultimately help the country, but also you kind of didn't. I guess you're gonna get into the time. You want to get into the timeline, but when I initially thought that the liberals were trying to sneak in, just trying to sneak in more power for
Hmm.
that they don't have to get parliamentary funding, you brought to me another theory that I didn't think about.
Yeah, so yeah, I'll get into that just in a second here. But so yeah, about Doug Ford, before we get carried out in the timeline thing.
Hmm.
So you've seen a bunch of people are writing that he's doing a really good job. It's quite surprising that the Toronto Star, which obviously knows everybody knows that is mostly opposed to Doug Ford, I saw a bunch of op-eds saying that he's shown well, good leadership in this time of crisis.
Yeah.
So for the most part, I believe that the political leaders in Canada have been quite responsible, whether it be on the federal level or provincial levels. I haven't seen any case of really outrageous, like something that's really outrageous or something that's causing as much controversy as in the US. But
Hmm.
there is that one provision, the controversial part that created a big a big mess this week was that the government was trying to get spending power from parliament was so basically the government would be able to spend as much money as it wants for 21 months, so till the end of 2021.
Hmm.
And then and then the Conservative Party came out and reacted to that and said, okay, this is a power grab. You can't just ask the parliament to give you one of its most influential power, which is the power to approve any spending from the government, right?
And just sorry to interrupt, but for me too, my first take was the same as I thought they were trying to sneak it in or something.
Oh yeah, it's so as we are talking about it, it was all bizarre because first of all,
Hmm.
nobody saw the bill before, so nobody saw the original bill apart from the political parties. Nobody saw the other bill that was passed.
Hmm.
Uh, Apart from even online, I went to the Parliament's website. The
Yeah.
bill wasn't there, so it passed the second reading and then the third reading, and like so they basically passed the bill at like 6 a.m. Uh,
Hmm.
Now it's like 2 days ago, I think,
Hmm.
and I was up till 6 a.m. watching the debate in Parliament,
Really?
and
This funny
yeah.
thing is, I was just watching till just because I knew they at that moment it was about three a.m. because I was
Mhm.
following it for the Beyond Culture Twitter just to see what's going on, and about
Mhm.
3 a.m. The Polyev tweeted, "Okay, it's fine. We finally got through it." And I remember
Mhm.
I tweeted about it. I'm like, they finally reached an
Mhm.
agreement, and it's
Mhm.
eventually gonna get passed
Mhm.
by today.
Yeah, so they got an agreement around 3 a.m. and then they went in the House to basically fast track the bill and pass it on the same day. So so they had all the debates, the questions, everything in that, like from 3 a.m. to 6 a.m. basically.
Yeah.
And I was watching all of that, and I was watching it, I went online to see the bill, right?
Yeah.
Because so it was being read in the house, but I also just wanted to see like the written copy of it, and it wasn't there. It was I found it when I woke up
Hmm.
on that
Then
day.
on that, you can say the next day.
Yeah, on on that day. But yeah, so basically this is what the new bill does. So it gives a direct payment to support low and modest income families. It protects seniors retirement savings by reducing the minimum RRIF withdrawal. It gives up to $300 more per child for parents through the Canada Child Benefit, and it gives temporary wage subsidies for for small employers to keep employees on the payroll. I'll come back to the wage subsidy because it has now just increased.
Yeah.
Originally, it was 10% wage subsidy, but now uh, the gov the government, the prime minister announced this morning that the wage subsidy will go up to 75%. So, which is
Hmm.
quite a big uh, increase there. But I guess the main part of this bill, where people, like for most Canadians, is the $500 per week for Canadians who lose income due to COVID-19 through
Hmm.
the Canada Emergency Response Benefit. Uh, they have $935 million aimed at addressing hospital capacities issues as well as ICUs, critical care beds, equipment, and COVID
Yeah.
assessment centers. And as you know this more than I do, given that you were more involved in the last
Hmm.
provincial elections than I was, and you know how big just healthcare is in how big of an issue healthcare is in Ontario. You
Huge.
remember you talked to me about
The
the
bed.
bed
Yeah.
short, yeah, the
Yeah.
bed
So
issue.
even the
This.
bed shortages, because obviously you work in an election and you hear about these things, and part of the NDP
Hmm.
platform was just trying to end hallway medicine. So patients getting treated in the
Hmm.
hallways, but I don't like you can work on a campaign as much as you can, but until you really go to the hospital to see somebody and you see the shortages of beds like live, just seeing um, patients in the hallway, or like even finding rooms, like it's I think there's just a moment uh, during last year when I was in the hospital to see somebody, and I just saw the shortage of beds live, and this was without the outbreak. And I think that's the first time I'm just like, it really is that bad. And one thing we need to keep in mind is that
Hmm.
as we're dealing with the COVID outbreak and we're trying to protect our healthcare system, you have to understand also
Hmm.
that people are still coming in with other diseases or sicknesses or gunshot wounds or everything. So at the same time, we're trying to treat COVID patients. You're trying to treat also people with other diseases and whatever, and that's where the healthcare
Hmm.
system crumbles, especially in Ontario. What Trump is trying to do is kind of make a list of medium, high to low risk counties, so that he's like, in those counties where it's such low risk, why don't we just reopen the economy and
Hmm.
let them go back to work and et cetera. But that doesn't work unless you basically restrict travel in the whole state. You can't reopen the economy in certain counties and allow travel to continue within the country. And on top of that, it's not because some areas are low risk that you can experience an outbreak. So there's a lot of flaws that are good that go into wanting to reopen portions of the
Hmm.
country. But basically, as I was talking before, the Dow on Tuesday had its highest growth of 11%, and that was as Trump was talking about reopening the economy, but mainly
Hmm.
because the basically the $2 trillion stimulus package was also being debated. So as it was getting debated later on to the night, the Dow actually plummeted towards the end of the night because they were still debating it. And where we saw the debate was because so Democrats believe that those because as we talk about
Hmm.
the quote unquote bailouts, they're like they didn't want there to be no oversight on the loan system given to these companies that were basically getting bailed out, right? So they wanted some sort of oversight because they didn't want those loans being given unrestrictedly. They really wanted oversight. And then what on the other hand, you saw the Republicans saying, "Wait a minute here," because as they kept on debating, the Republicans were like, "Wait a minute here. Some people will make more money with this in unemployment insurance than they would if they were working." Specifically, I'm pointing to Senator Lindsey Graham. He's like, "You're literally incentivizing the taking people out of the workforce at a time when they need critical infrastructure supplied with workers." He said that on Wednesday night, and he was referring to the unemployment benefits that the Democrats also wanted to widen a bit. And I'll get to those numbers later on. But to me, I looked at it this way: if because these unemployment benefits are only gonna last 4 months, if somebody is willing to risk their full time employment for it to be on unemployment insurance that only lasts 4 months, first of all, not many people are going to do that because that's just not smart. Because you also have to apply for unemployment insurance, so you're not 100% sure that you're going to get it. So you have to apply for it first, and then second of all, if somebody is really going to leave their employment situation for unemployment insurance that only lasts for 4 months, that means they must be in a really tough place, like a really tough place. So you already see for me the argument that you incentivize unemployment. I don't think it really holds weight.